human resources are disposable. Most of our staff are in the community. So if it's not working in as an inpatient or OPD basis, you have a question. Some people come in to check their vitals, which is free of charge and is accessible to the community as well. And then if you are in the house and then you want to check some labs, you have some questions, it's also available. And currently we are planning about having talks with the community in some of the stations, and then the what do we call it? Um, those who are now
Okay, the community centers.
community centers to have health talks to help the community
Okay.
about some conditions, because sometimes when they get here, conditions you think they should know about, it's like it's news for them.
What's your name?
I'm Sichofa Amengo.
Okay. What do you do here?
I'm a nurse.
You're a nurse. Okay. What's your main duty being a nurse here?
Okay, so basically, since I'm at the OPD, when a patient walks in, the patient talks to me first. So I check their vitals. I ask what their problem is, what their issue is, the reason they came around, and then I enter their details and then forward them to the doctor.
Okay. So this whole place is networked.
Yes, please.
What's the lasting impression you leave on your patients? Because you're the first face they see, so I imagine you smile a lot.
Yes.
Otherwise, I won't come here.
So you have to be comely towards the patient. Yeah. No matter how disturbed the patient might be, being a nurse, mostly the patients you come across, because of what they might be going through, whether health wise or emotionally, some of them walk in here troubled. So sometimes the face they give you, if they meet you outside, you'll be like, no, this is not it. But no matter what, you have to be comely towards them, smile, welcome them, make them feel at home.
What motivates you to wake up every day and come here, sit here, go through the expressions, worse, bad, every day, and then you have a smile on your face all the time?
Okay, like I said, everyone has their own issues. But then this is what I chose to do. So it and you can't do nursing without having bad days. That one, it's something which is there because you have your issues, the patients have their issues. If you're not calm yourself, you'll be in trouble with them. So my motivation is just coming here to help the patients in any way I can.
Okay.
Because helping people sort of gives me a level of satisfaction.
What are some of the services you provide at SW Clinic?
Okay, so at SW Clinic, we provide almost all the inpatient and then outpatient services, with the exception of surgery. So, with the outpatients, the normal malaria, typhoid, STIs, chronic conditions like diabetes, hypertension, asthma, sickle cell, we have a clinic for those ones as well. And then walking, if you want to walk in to maybe run labs on yourself or a scan or an EC, we also provide those services. Then ANC, then postnatal care, family planning, both the pills, the injection, the implants. We provide all those services.
You mentioned that with the exception of surgery.
Yes.
Have there any future plans to expand the services
Yes.
and include surgery?
Yes.
Okay.
There are plans for that to include the surgical ward and stuff. So we are looking at that.
Okay. How are you prioritizing patients' comfort and convenience?
Yeah, we are trying to prioritize both the comfort and then the experience. The comfort, in the sense that when they are here, we provide comfort regardless of whatever you are coming with. And then since it's a new place, we have to combine affordability with comfort because of different backgrounds. So we make sure that at least whatever you are coming with, it will be affordable for you, and then you'll be comfortable with the place and then the staff.
I like the fact that everything in this place is digitized, so there is less contact.
Yeah.
How do you plan to integrate this with the local community?
So we've started, most people will come, we need a card. They'll be thinking we are still going with a paper kind of thing. But since it started, we explained to them that, oh, all we need is your information at hand. And then everything will be on the system. So you don't need to come back with a card or anything. Once you mention your name, everything is on the system. So once you explain it to them, they're able to understand how it's going.
Okay. Do you have any partnership, because I'm now aware that you don't accept, for now you don't accept the NHIS.
Yeah.
So, are there any partnership with any company to assist you, because you have a lot of machines around? I can only imagine that someone looking at the compound itself from outside would think, oh, this place is expensive, it's for the rich. But then we know, we have to be honest, everything is going up, the prices
Yes.
are going up.
Yes.
But do you have any partnership to help you provide um, affordable, at lowest affordable healthcare with the maximum quality for the community that you find yourself in?
Currently, it's those we have this partnership with some of the pharmaceutical companies.
Okay.
So that's what we've established for now. They give us their drugs, and then we sell some, and then we're able to pay later. But apart from that, the rest is solely individual based on the CEO and then the shareholder. We've not yet received any partnership from anyone else apart from those pharmacies who are helping us now.
Okay. So, how can the community utilize your clinic's resources?
Well, first of all,
Because
our human,
you mentioned the walk-in,
yeah,
which means anybody at all can walk in and then be given the best treatment of their life.
yeah. So with our human resources are disposable. Most of our staff are in the community. So if it's not working in as an inpatient or OPD basis, you have a question. Some people come in to check their vitals, BP, which is free of charge and is accessible to the community as well. And then, like I said, if you are in the house and then you want to check some labs, you have some questions, it's also available. And currently, we are planning about having talks with the community in some of the stations, and then the what do we call it? Those who announce
Okay, the community centers.
community centers to have health talks to help the community
Okay.
about some conditions, because sometimes when they get here, conditions you think they should know about, it's like it's news for them. It's news
Wow.
to them, yes. So we are currently working on that for them.
Let me ask you, why is it that Ghanaians, we don't like checkups? Like we when you go outside of Ghana, there are lots of people like sweets, and then they know sweets will bring them this and that kind of disease.
Yeah.
So in order to prevent it, they have to go and check up regular basis to see if they are falling into the danger zone, and then they quickly seek remedies. But we will eat aliwasa without going
Going
for
for
checkup.
checkup.
Why do we have this in our system? Why do we have this mentality?
I think financial problem is also part. It's the major thing. The person might think going to check how much are they going to take me, and then if they find something, the cost of treatment, the person might not even come to ask how much it would cost. They would just assume that, oh, then I'll be using this much money for, or then I won't come. If I don't find out, I have nothing to worry about. So I won't make it a point to look at it. That is what mostly they say about it. And then ignorance too. There are some people, even they are having signals of those conditions, but they think it's normal. They discuss with people in their community, oh, it's normal, you are growing, it's normal, it's part of age. Not knowing they are having signals, their body is giving them signals. They're taking it as the usual
For
thing.
granted.
Yeah.
Help me with this one. Are there incidences where you can use herbal medicine alone to solve the predicament you are in? And are there incidences in the patient's life where it has to be orthodox?
Yes. So currently, I think I was working in a government institution. The Ministry of Health has added herbal medicine to the routine OPD. So there are some public hospitals, there is a section for herbal remedy, which is regulated. The thing is regulated.
Okay.
There are some conditions, yes. Herbal medicine has proven that they can treat it. But how is it being regulated? So the ones Ministry of Health has brought on board, they are the ones accredited that we know they are being monitored. The drugs they are given, the person knows, the herbal doctor knows what he or she is going about. They request for labs, they request for scans, like orthodox medicine. And then they themselves will tell you it's not everything that the herbal medicine can solve. There are others
Okay.
they would refer for orthodox treatments. The others they will refer. So there are some yes, but then there are others you have to see an orthodox medicine so that we know how to take it from there.
Okay. Which area of specialty do you focus on personally?
Personally, emergency medicine.
Okay.
Emergency
Can you
medicine.
explain that to us?
It's mostly things that are unexpected, like injury, sudden illness.
Okay.
Yes. So sudden pain, sudden illness, sudden loss of consciousness, road traffic accidents. Yes. Mostly that is what it entails.
Okay, so you were born for this. Yeah, because you mentioned road accident. Yeah. So, Dr. Ruby, why did you decide to go paperless in this clinic?
Okay. So with the normal using of the papers, the folders, it's usually difficult to keep the records for a period of time, even with the most dedicated record keepers. You see that you get to a point you go to the hospital, they are not finding your folder, they are not finding your records. And then it would mean you the patient would also have to keep the card. So in case you misplace the card or you don't remember your last time for coming to the hospital, it will be difficult to retrieve them. And then came the COVID thing. We want least contact with patients. If you are going with the paper system, you will take folder. It means I'll be handing something over to you. How clean are your hands? How clean are my hands? Yes. We will try to keep them clean, but then is it always so? The patient will give you his or her card. You have to give prescription to them. So the contact will be frequent. But with the paperless system, everything is on the machine. So there's less contact. And then I don't need you to be having your whatever, your card, your folder all the time. If you've even forgotten your number, the only thing I need is your name. If I type in your name, come like 10 years later, 5 years later, your record will still be on the system because it is stored on the cloud. So anywhere you go, if it's the same system, it's accessible. Any other doctor can get your records. Even if you don't remember everything we did for you, once the person has access to the system, your records are saved and then they will know how to proceed.
Well,
My name is Martin Yao Jandu, Administrator, SW Clinic.
okay. Nice to have you here. What inspired the opening of this clinic?
Okay, so SW Clinic was opened in September, but before that, um, with the entire society, there's no healthcare or there's no clinic around. So we decided to open the place to serve the community in terms of health side. So our inspiration is to help the society in terms of health. One.
Can you give us the location to the place?
Yes, SW Clinic is located at Yellow Container. Yellow Container. When you are coming from Kaswa, you are light at Yellow Container, and then the rough road on your right, you just come straight and you meet SW Clinic. If you are coming from Nurses Quarters, Amuzu Kofe, or if you are coming from Shalom, you are light at Yellow Container. You cross the road and then use the rough road.
Okay. So, what's the unique thing about SW Clinic? What makes it unique from the others around this area? Because now there are lots of clinics being opened around, and then there are other clinics that are not that far from here. So, what makes this place unique?
Okay, so thank you. Our environment is serene. We have a nice environment, very beautiful environment. We have qualified staff also, and also our services are very cheap and affordable. That makes it unique when they come here.
Okay. Was there any gap in healthcare that you foresaw to fulfill? Like, what gap in healthcare did you see that you aim to fill?
Okay, our vision is our patients. So our focus is our patients, trying to serve patients. So the gap we want to bridge is to serve and satisfy our patient. That's how we say our patient come first.
Is this place expensive?
But this is
Or
not
is it,
expensive, it's affordable. Yeah, our services are affordable.
how do you ensure your staff stay up to date in the latest medical advancement?
Okay, so usually with the districts or with the municipality, when they are having symposiums or trainings, we liaise with them. Then our staff also attend such symposiums and trainings to get abreast with the new technology in the health side.
I recommend SW Health Clinic to everybody out there. But in any way they want to visit any health facility, I recommend SW Health Clinic for them to come because we have the best workers here. So I recommend it to them.